right, hello everyone. We are live from NCPA and hungover as hell. Hey Monique, how are you feeling today?
I'm feeling okay because I had a liquid IV earlier, thanks to one of the booth sponsors over here.
Yeah,
like that. Yeah. So feeling pretty good.
Yeah, it was a good time yesterday. We did the PUTT cocktail party with a bunch of friends of ours, and well, I double fisted JMO all night, so it's been a struggle. But my good friend Josh hooked me up with his BioLite punch, so hopefully that will make it better. But yeah, it's been a day and a night. It's been fun. Lots of connections.
So we had a Beetlejuice bar.
Yeah, we did.
What did you get over to the Beetlejuice bar? Did you see it?
I did. I got to go over and see it, but I was like, it was one of those things where it's like, it's fun to like go and see them, but it's also like these events, like there's also so much work to do because you're talking to a bunch of people you don't get to see all that much. And, that's where a lot of, relationships are formed and problems worked out in a lot of ways. Like, I was over talking to Ben Jolly and the American Economic Liberties Project crew for, a good hour. I was talking to Bill Schmitnick, for a long time. It's just one of those things where, you get everyone together and you're having fun, but it's fun with work being done. So it's important.
And it was great. It's great to see so many old friends here. We've got the benefit of, so we're, for example, it's, so you can't see it because you're looking at us, but over to our right, we've got our good friends over at the Pharmacy Insurance Group. Bozeman and Snow is over here to our left. I can see directly across from me, CPA buying group friends. APCI, talked to them, their friends. American Pharmacy is one of our hosts. Last night, their friends. It's really been fun. I've enjoyed it a lot. I'm just really glad that we've had the chance to reconnect. But you're right, it's a lot of work.
It is. It's a ton of work. I mean, we're out here. We're pushing 9096 with everything in us because that's going to save us. And
as I'm pointing in a scary way at the camera, I'm going to ask Kendra to bring me a bag so we can once again, thank you, once again, just show this is what we've been passing out. And it's equal parts advocacy, but it's also kind of a social experiment. So what we've been doing is we don't just stand in the booth. No. We walk around, we hand these bags out. So we've been asking everybody to hold the bag out. We've got people pinned. Sometimes we've walked right up and pinned somebody, 9096.
It's true. Monique stabbed a few people. There was a lot of yelling, but we're all right. No one went to jail.
Fortunately, blood can be washed out.
It can.
And we say that a lot. Now.
That's actually one of our mottos is blood washes out.
Blood washes out. That's right.
Pretty metal. I'm going to say it's a really metal motto.
Yeah. Yeah.
Hey, how are you?
Hi.
Yeah, grab you some pins.
Definitely.
Thank you.
Yeah, wear them with pride for sure.
Yeah.
Oh, fantastic. Thank you. Awkwardly, around the corner is another podcast going on with some people we know. From another podcasting network, and they weren't, so far as I could tell, here yesterday. So I don't know. They may,
They were earlier.
Or were they?
Yeah, they were here yesterday.
Were they?
So I think they do like an entire event, like it just rolls through and they're constantly doing something. It's cool.
All right, good. So that's good. So as long as we're all good, that we're all podcasting, that's amazing.
Yeah, exactly. Get the word out. We support that entire podcasting community. As you all seen, like I like to invite the other podcasters to come on, like have fun with us. Like that's how you like foster a great community and you get some really great content. Like what Fluence LA are doing. I wish they could have come. Like she is putting some great content out in the like the Real Housewives of Pharmacy, like ripping on PBMs. It's been like she's doing some really good stuff.
That's great. Really good. So we've had, and even then, so we had a TikTok personality, Dave, come by. I'd never actually met him because I will be the first to confess that I'm rarely on TikTok, and when I am, I'm looking at dance videos. Remember when TikTok first came out and everybody was all about the dance videos? I think I just got left there. So that was 5 years ago?
Yeah. We're live on TikTok, but I've had to shut the TikTok live down because we really don't have the literal bandwidth to get the signal out because we got to hotspot it to do it. So I can only do StreamYard, and our TikTok fans have had to miss out, but I'll upload later.
Appreciate
Hey,
you.
how are you?
Thanks.
Yeah.
Yeah.
Hey, thank you. You want to say hello to everybody?
You want to come over and
On the
say
podcast,
hi?
we're live.
Come on over.
Here. Come talk to us.
Sure.
Hey,
Tell
everybody.
us.
This is Trevor.
Hello, I'm Trevor.
Nice to meet you.
Nice to meet you guys.
Trevor, where are you
Yeah, it's
from?
good meeting you, brother.
From Topeka, Indiana.
Nice.
Where's Topeka, Indiana?
Not in Kansas, but
Not
probably
in
20 minutes,
Kansas.
30 minutes south of Michigan, about 30 minutes off Ohio. So just in that top right corner up there.
Great.
Yeah.
Really
Little
good.
Amish area, but it's fun. It's good stuff, and man, it's hard out there.
Yeah.
It's hard out there for everyone's getting murdered, man. That's why we got to pass 9096. Because if we don't, I mean, it's done. We got to establish like baseline reimbursements where we're actually, making a little bit, at least to, break even.
Just
and
at
pay
least,
for our
break
costs.
it even at least, because
That's the thing. Like everyone's like, what about the cost to the system? Fuck that. Okay, I'm sorry, but like you got to pay pharmacies enough to exist.
I mean, just make it reasonable. Yeah, exactly.
Yeah.
I mean, it's ridiculous to have a law that says, "Hey, follow the law that the state says, pay this amount of money." Like,
Right.
and then they don't do it.
Of course they don't.
We had to get a law to get an audit in Indiana done, and then I have to go talk about that. I'm testifying on Tuesday.
Nice.
So that should be fun.
Congratulations. Thank
So we'll
you for
see
that.
if that goes anywhere. Hopefully, but yeah,
So we learned recently that Indiana has been pretty progressive in some of your PBM
we're
laws.
trying.
Yeah.
It's not enforced.
Really?
That's the problem.
Oh,
The
yeah.
laws are there. They're not followed. I got patients that have gone through all the steps. We're filing complaints with the Department of Insurance, and basically the response is, "Oh, we called and they said it was fine."
Yeah.
And it's like, well,
Of
yeah,
course
I
you
would
did.
say that too. If I robbed a store and just said,
Yeah, and that's
the cops are like, "Hey, what are you doing with all that stuff?" I'm like, "Oh, Jim at the counter said I can just take all this out the register. It's okay."
No,
all right.
That's the thing. They ignore the laws, and they know good and well, like you're going to have to sue them or do something else to, go at them. And they just dare people to do that.
I mean, you look at all the stuff from July, those testimonies, in Congress,
Yeah.
they're pretty much everything short of lie, cheat, and steal publicly, and say like to the point. Oh, and then sue the government for
government.
for calling them out for breaking the law. Like it's crazy.
It's hilarious that they're suing CMS right now for the star ratings. If they win, are they gonna like give us some of that back because of the star ratings? Like
It'd be all right.
all of that got passed down to us, and they're upset that they're not getting more money. God, I hate them so much.
But I think you're referring to that new cottage industry where you steal from taxpayers and then you sue the government for holding you to account for stealing from the taxpayers. It's like a new trend in business.
And and I do agree. It's multiple industries too, right? It's not just pharmacy getting kind of jerked over. It's all kinds of different industries right now are getting kind of beat up on that. And
it's true. It's true. So this is how often do you go to the NCPA conference?
I've been 2 other times back when I was in school, and then once since then. I usually go to some other trade shows, but this one just worked out this year, and I always love the programming here. I feel like it's a lot more applicable. You get to see the legislative, what's going on, and it's not as much pressure from one sponsor, So I like what's going on here, and it's I'm all for people making a buck and everything. If there's a value added in, I just don't see it on the PBM.
Oh no,
side
it's no value. They're vampires. I mean, full on. They extract value. They don't contribute anything to the system.
Here,
There you go. So,
nailed it.
So for the audience, that's NCPA's advocacy T-shirt.
Yeah.
Pharmacy benefit manipulator.
Yep.
Nice.
Yep.
Very nice.
It's been pretty fun. But hey, I'm gonna let you guys stick to it. But thanks for
Thank you.
getting out there, and
Hey, thanks for everything
keeping it
you're
going.
doing, Trevor.
Thank
You guys take care.
Keep at it,
Great
brother.
day. And that's part of the fun too of being
Yeah.
here is that I'll just move this back over, but you get
We get to see everybody.
you get to talk to people and find out what they are doing in their states and how they are supporting the federal level, and then we get to meet new people to join our PBM reform.
Yes.
Our state Google groups.
Even PUTT itself, like we get new members doing this. We get to have fun. We get to meet people that we've been working with, forever in a lot of different ways. And it's fun to encounter that. Like I like going and, walking around and having people come up and be like, "You're Jeremy." I'm like, "I am Jeremy." It's fun to see everybody that, you interact with online.
Yeah.
It's a blast.
Yeah.
And I mean, this is an important part of advocacy is seeing each other, we're all friends. We're all fighting the same battle. This is what we got to do.
Well, and then there's a lot of information sharing going on.
Yeah.
So as we are out here talking with people, we're finding out what is happening in the states. Like Trevor was just saying, so we have these laws, but enforcement's a problem. And enforcement has been an issue for years.
Of course,
it's one of the things that 9096 is doing. It will do really well.
Yes.
The enforcement arm, criminal penalties for infractions.
Criminal penalties, like full-on felony if you violate it. Like we're forcing the PBMs to make sure that pharmacies are taken care of and not hurting, patients. Yo.
Come on over.
Come on, Kunal. How are you, brother?
I'm doing great.
So good to see you again. Come join us.
How's everybody doing here?
Oh, dude, it's
really
good.
good.
I'm struggling a little bit after we all had fun last night.
Hey, I went to sleep at 10 because I'm an old man now. I can't handle it that
much. Dude, so you went to bed at 10. What time did you get out of the cocktail party? What time did we end that thing? I don't even know.
Well, all right, so no, technically ended at 8:30.
Yeah.
But a lot of people stayed after to just, have conversations. It was, and that's really all that happened. It wasn't like people stayed till 1 a.m. and, were slamming drinks or anything. It was just really good conversation about how are we going to forward the industry, our work, and not our work at PUTT, but our work as an industry.
Meeting a lot of famous people in my life. Angry Dad, famous guy to me. That guy.
Oh, yeah. Bill is awesome. He's a friend of ours.
And I told him, whatever we can do to support, tell you the same thing. Whatever we can do to support. This is our time right now.
It is. It's our time.
It's been decades plus since they've been pretty much treating us like the redheaded stepchild, if you want to call it.
They have.
Like we've been treated in such a way for over a decade now that I just feel the energy's there now, right?
It is.
And then when you get people like Mark Cuban and other people that are involved, maybe they can push the envelope. Dina Khan, God bless her.
Yeah,
place.
Yes,
my queen.
Whoever comes as president, please, let's keep her there.
Yes,
right?
she must stay there.
Did you by chance see that Mark Cuban was on Bill Maher?
Yes, I did.
Last weekend, the actual first thing that he talked about was PBMs hurting independent pharmacies.
The plight of independent pharmacies.
It was brilliant.
So
really appreciate him.
So we got to push Mark though, because Mark, it ain't done yet. We got to keep going. All right.
Yeah. Mark, his big focus, of course, is the market end, and we talk about this a lot. That going after PBMs, and that was our big focus this year. Was it was 3-pronged. We go after PBMs by legislatively, we go after them with litigation, and we go after them through the market, a market solution. And I like to add a few more on there as far as FTC regulatory. And then my favorite is the fifth one. I call it the pitchfork, the 5-pronged pitchfork. The fifth one is resonance. Like we got to resonate when we deliver our message.
100%.
So that's how we get this done. And we fought for years to bring attention and do all this. And there's, it's been a lot of work, but we've got to where they're paying attention now.
Yes, 100%. Both sides of the aisle too, which is important.
It's very bipartisan
situation here, and we need to get it pushed through. Period. There's no other choice. Like you said, what is it?
9096
or die.
That's how
we pass it, or we're gone.
So
on there.
The one person who's available 365 days a year, the health is not the doctor; it's the pharmacy.
Yeah,
the pharmacy is available every minute. You see a doctor once every 90 days. Easy accessible, and people want to destroy that.
Yeah,
it's not going to work.
It's not.
We're not department stores. We're pharmacy owners.
Yes.
Amazon is not going to switch that button off. Nobody's going to take the care that we provide in our local communities. My job at RX Mile is to bring all the independent pharmacies together under one umbrella. So now we have the data that can. Those guys that hire the assholes, the insurance. Sorry about my.
No.
This is PB on the rocks. You've seen this before. You don't get them well.
The insurance companies, they're the ones who hire these guys. If they understood that they're being penny wise, pound foolish, using this mail order bullshit service.
Yeah.
When we got local community people who actually know these people by their first name and give a damn, know who their kids are, and are making sure they're available for them. It changes their Part D quality scores. It changes their costs. It changes their readmissions in the hospital. Nobody sees that because everybody's in silo. We want to put it under one umbrella.
Yes.
It's undeniable. And our voice is so loud that nobody can deny it.
Exactly. And you're doing great work with that. Tell everyone about RX Mile and how like you came to start this.
It's a long story, so I'm gonna make it short.
Okay, make it the short one.
So I was a pharmacy owner myself. I sold it in 2019. During that time, I did service 30,000 Medicare Advantage patients. My uncle owned a large MSO. In 2019, he sold his practice. I sold my pharmacy. And the key component was home prescription delivery. Make sure the patients were able to get their medications, whether it was an indigent issue where they couldn't afford it, couldn't get the copay, transportation, or whatnot. And with us doing that, I decided after I sold the pharmacy that let me look for other pharmacies in South Florida that kind of need this same component as I did for myself. So we started working in large groups like Leon Medical, CareMax, SEMA Healthcare, Broward Health Systems. We do about 3,000 to 5,000 deliveries a day just in Miami. And with that said, I said, I used this software as an independent owner and I had my own drivers. And now I am the outsource option for pharmacies who don't want the headache and want to outsource it.
Yeah.
But, I'm wearing a hat here, I'm losing all my hair. I don't want to do it all over the country. So that's where RX Mile came to about.
Yeah.
So RX Mile is a pure SaaS platform, which is utilized by two B2B models, which is pharmacies that have their own internal deliveries that they want to do with their drivers, or pharmacies that want to outsource. At that point, it's courier companies that we built it, a vetted network of courier companies that understand what PHI stands for. They understand that they got to do HIPAA training with their drivers, temperature control, climate with the medication delivery process. I'm a big proponent on that. Like our friend, Ms. Bosley.
Yeah.
We don't believe mail orders the right way. You don't put it in an oven, which is a mailbox, and nobody's even notified it's sitting there. Do you check your mail every day? I don't.
No,
right? and the crazy part is the people who pay taxes for 10 years of their life to be able to get Medicare Advantage, and the people who went and fought for this country as veterans are the two people who are mandated to have to use that type of service. Can you say placebo effect?
Yes.
And how can people not even realize that? Like that's the whole concept of mail order. So I figured let's build this network. Let's provide the data so these insurance companies knows that this patients that you care about, you treat like a number, but we treat like a human. They're getting better treatment versus using your mail order pharmacy. So you got to figure out how do we approach the subject. So everybody's doing their part. You're doing your part. My part is this part.
Yes.
And the other part you mentioned, the 5 prongs, right?
Yeah.
I'm going to add one more on there. Technology.
Yeah.
With our technology platform, we're knocking on, let's say, 100,000, 200,000 homes every single week.
Yeah.
These are the people that need to also open their mouth and know which way they should be voting. So I'm willing, and I've spoken to you about that before, that whatever we can put it within our technology when these drivers are going to the front door, petitions, whatever we want them to do, so we can drive more. That documentary, let's put some money behind it and get that on Netflix or Amazon.
Yes.
It's got to get out there.
Yes.
These people on the ground need to understand what the hell's going on.
They do.
Right? Because they don't know. They have no clue.
They don't. And it's patient education. And I love everything you're doing. And I'm going to be looking at using your services instead of making my technicians run out and do deliveries. Are you available? What areas are you available?
The whole U.S.
The whole U.S.
Whole U.S., Canada, Puerto Rico. Our plan is to go global with this, but I want to first fix the problem here.
Yes.
Which is what we're working on. Bringing value back to the independent pharmacy is my key. That's my only focus. That's my passion.
Yes. Now, brother, it is great to have you on.
Yes.
Like, I love everything you're doing. I love the fact that you came up and you were like, you're Jeremy. I love everything you do. Like, it's awesome to have that kind of support. And it's awesome to have people like you who like appreciate what we're doing here at PUTT. Like, it means a lot to me, and it's been awesome to me. It was awesome hanging out with you last night, and we're going to do a lot of fun stuff in the future.
100%. This is just you guys are stuck with me now.
Yes.
Awesome.
It's just the beginning. I'm here.
Good.
Can't get rid of me no more. All right, my
I'll
brother.
see you, man.
Love you guys.
you
Yes.
so
Everything you
much.
guys do and everything I can do to help the cause, and I appreciate being able to be here and sit down with you.
Hey,
Thank
always.
you. Very humble.
Thank you
I
so
appreciate you
much.
guys. Thank you.
All right.
All right.
I'll
well,
see ya.
We'll see you on a future episode.
Yes.
Yeah.
Thanks. I mean, how can you
What's
not
up?
be inspired by that?
Yeah, I'm aware of that.
Yeah.
What? I know I'm live
That's
on
okay.
Twitter.
All our fabulous production. I just want to take a moment and say thank you to Andrew and to Kendra. They are our support staff over here. I know you can't see them. I'm looking directly at them, but they are the ones where I'm like, hey, so like I need a bag. Or in this case, I'm going to say, could one of you mind bringing me some water? Because my throat's a little bit dry. But also they are manning our booth. Yeah. So we're doing this. We're here, and then just directly in front of us is them and a whole lot of people, and they've been handing out bags. And
speaking of Loretta, there she is.
There's Loretta.
Loretta's RX Miles #1 fan right here.
Loretta, hey.
Yeah.
That's great.
Hey, there's my dad. Hey, Dad, come say hello.
Yeah, come on.
My dad's here, everyone. Yeah, he gets to witness me be hungover at a professional convention like he's had to witness his whole life.
And then there's Rupesh, who's not going to go
there's
anywhere.
Rupesh. Come on, Rupesh. All right, Dad. We'll get you on in a second. We got to get Rupesh. Say bye to Dad. Get out of here, Dad. No, you're good, man. Come on. Jump on.
Come on.
Get out of here, Dad.
Jeremy's dad is amazing.
Yeah, Dad's been taking care of us all weekend.
Really, really amazing. Thank you. And then also that can go. Thank you. All right. And I have water.
Come on, Rupesh. Come on in, man.
Come on. Nice to see you.
It's good seeing you.
All right. It's always a pleasure to be here.
Yeah. You are one of my favorite people on earth. I just want you to know that. Well, I never get to talk to you. I know you interface mostly with Monique and everything, but I think you're wonderful.
No, this is the first time we met this conference.
Yes. Yeah.
Really? Yeah, I didn't know that.
Yeah, we've been interfacing mostly through Dave Baggett.
Yeah. Dave Baggett's also my favorite interface.
Yeah, he's in the earth, and so the earth is fairly large, as we all know. So to be a favorite person of Jeremy's or mine on this earth really says something about you and who you are and Dave Baggett. So where do we want to start? My goodness, there's so much to unpack here.
Wherever you start will be the beginning of a circle because it's keep going.
Okay, yes. All right. So we are all working together on HR 9096. You are the immediate past president of the Illinois Pharmacists Association. You're a pharmacy owner in the Chicago area. Yeah. You own more than one pharmacy?
I have more than one store. They're small rural pharmacies.
And so you're taking care of population that needs access to medicine, as we all do.
Right.
And so for everybody who's been following us and following our podcast, of course we're focused on 9096 and 9096. We are at 38 co-sponsors.
Yeah, I think we're at 37 right now.
37 co-sponsors.
37. I mean, we went out and we hammered it. It's been tireless, like the grind, and everyone's out there. Greg he is constant with it. We're all doing this constantly.
Yes, we are.
So it's every single one of them was hard earned. Mm-hmm. So it's really cool to get to where we're sitting in a really good position to where we're going to hit 50 by Thanksgiving like they asked, and we're going to have even more.
Now, one of our first co-sponsors, though, we got because of you.
Yes.
The one in Illinois, Congressman
Raja Krishnamurthy. He helped us out on this. But again, we have a long way to go.
Yes, we do.
And, we keep working hard at it.
Yeah.
That's our effort. One thing that I've learned through Monique, through PUTT, that if we don't get involved, we are not going to get anywhere. Because the challenges we are facing is becoming a national challenge. It's becoming a pharmacy challenge.
Yes.
And that's what we need to work on.
Stay here. You're
it is a huge problem.
Here. Yeah. Sorry, we're live. I apologize. Sometimes when you recognize somebody as amazing as Rupesh, but from Arkansas, not from Illinois, you have to say to them, "Don't go anywhere." And he's not because he's chowing on popcorn right now. Sorry. Forgive me for that.
No, I mean, this is a huge pharmacy issue. It's a healthcare issue. It's a patient safety issue, and we're at the point now where the vampires have sucked so much blood from the system. There's nothing left for us to live. And we've got to establish that baseline. We've got to establish reimbursement and address steering and get it locked into where we can even exist.
So the main thing that I feel that the legislators need to understand that it's not a pharmacy that's getting hurt.
Yeah.
One pharmacy may go out of business, but there'll be 5,000 patients, 5,000 citizens that are going to get hurt. Yeah. And we need to keep our focus on that.
Yes.
And access to care is a big thing. And the unfair practices are basically not hurting only a pharmacy, but more importantly, they're hurting patients.
Yes.
And it's supposed to be about our patients. We are
It is.
ethically obligated to take care of our patients. And
Yeah.
we want to focus on that.
Exactly.
Yeah. And we had Kunal on just a minute ago. He has RX Mile, and he was talking about, what's going to happen whenever you have all these pharmacies closed. Like, what are you going to do? Because this is where a lot of people access healthcare. It's easy to get a hold of a pharmacist and talk to a pharmacist, but getting in to see a physician, you're going to have to wait. But your pharmacist is always there. So it's going to turn into it's not even just a pharmacy desert, it's healthcare deserts across the United States.
I want to thank almost every pharmacist that's out there. We don't only consider our patients our family, but our patients consider us their family. They call us on our cell phones.
Yeah.
So this is a two-way street.
Yes.
So they're hurting the pharmacy family, and patients are part of the pharmacy family.
If they are.
Really well said.
Yeah.
So I would like to talk about another aspect of some of the work you're doing, which is leadership.
Yes.
So we exist to empower our fellow pharmacy owners that they can do this. They can advocate. They can participate. And you've been doing that work. Now we're in a position, particularly with 9096, where we could bring ourselves together, our different organizations together, coordinate, our actions and our messaging, and really work to push something together. And I know you're driving that, or you're really trying to drive that for pharmacy, the pharmacy
So
side.
I want to, first of all, I've learned from Illinois Pharmacists Association with having friends like Dave Baggett, Dave Folk, Lauren, and everybody. These individuals have basically teamwork with us. In Illinois, what we have done is we have taken this beyond an independent pharmacy situation, because it's not. This is a pharmacy situation that we need to resolve. So we, through Illinois Pharmacists Association, we have taken other stakeholders like IRMA and the unions and all the other leadership, and trying to work together to meet the challenge, head forward together.
Yes.
And there is success. And seeing what we have been able to do in Illinois, where we haven't crossed the finish line, but we have moved forward.
Yes.
And we need to continue doing that. But this same process needs to happen nationally.
It does.
And we all need to work together. And pharmacists are partly responsible for their work. They cannot expect 20% of the pharmacists to do 80% of the work. Every pharmacist has a relationship. We need to take advantage of the relationship so we can pass the message to our legislators. What the absence of a pharmacy is going to create a problem. So we need to work together. And I urge PUTT, NACDS, NCPA, APHA, for us to come together.
Yes.
Because we are not saving a group of pharmacists. We are saving the profession of pharmacists.
We are.
Yeah.
And more than that, we are saving access and care for our patients.
We are.
And we should never forget that. So we need to now, this is the time we need to come together.
This is the time we come together. We're better as a unit. We really are.
We are what, over 300,000 pharmacists in the nation?
Yeah.
We need more action from every single one of them.
Every single one of them. It's time to step up, everyone. Like, get involved.
Yeah.
Like, it's important.
And thank you for stepping up.
Yes, and thank you for everyone who has.
Yeah, because a lot of you are, and it looks all different ways.
It does.
But we need more.
We
That's
do
just
need
the
more.
reality.
If you're not getting involved, you need to start getting involved. Even as simple as contacting your lawmaker and being like, hey, be a co-sponsor of HR 9096, because sometimes lawmakers and their staff, they need to be educated on this. They need to be made aware of it. So it's important when you reach out, because if you're doing it, a few people are probably doing it too.
Yeah. I'm just getting Kevin's attention for something. And I apologize. Because again, we're live. We want yes.
Yeah.
You. So Rupesh will say
But thank you for what you guys are doing, and hope we can all work together and make something happen.
Always,
Yes,
Rupesh.
Thank you very much.
Brother. It's good
It
meeting
is
you.
such a pleasure.
very
And then
much.
I sent you and Dave a message for a call this Thursday so we can start, because we're going to start the leadership thing
We are.
right
Appreciate
away.
it.
So we're going to start this week on that.
Thank you very
All
much.
right. Thank
Does.
you very,
I'll see you,
very much.
Rupesh.
All right. Okay.
Yeah.
So I'm
All right,
a
Scott.
fangirl of this guy. Scott Pace is here. Scott, it is
Happy
so
birthday.
good to see you. Thank you very much.
How are
Good
you?
meeting
It's
you,
good to
Scott.
see you. I see
Yeah.
you in person.
Yeah.
We've talked online before.
Yes.
Yes.
It's really cool to see so many people you interact with online. We were talking about that earlier, seeing them in person. That's why events like this, it's important. It's important to have everyone come together and have fun together, really. Have a few drinks, have some food, go around, check out what's going on in the industry. It's important to do that.
It is. That's where a lot of my good ideas come from.
Exactly.
From other people. So
Yeah.
it's great to do it. I tell people my favorite part of NCPA's name is the C in community.
It is
because it's the community of people that really make this industry special.
Yeah,
so
exactly.
So Monique and I have known each other for years.
Yes, I wouldn't know.
I came by yesterday, and you were intent interviewing somebody. So I had to come back by today to say hi.
Well, I'm glad that you did, and so for people listening, so Scott was behind what eventually became Rutledge versus PCMA.
Yes.
Yep.
And now I was talking with John Vinson last week.
He's doing an amazing job.
He is amazing. And we are talking about the emergency rule. Are you familiar with any of
that's the emergency rule 128.
Yes.
That is currently, the emergency rule has been gone through the process, and now they're trying to approve the final version of the non-emergency version of that rule.
Okay.
But all of it
not
is
confusing at all.
Yeah, it's not confusing. It's just part of the regulatory process in Arkansas, but it's really designed to enforce what was part of the PBM licensure bill in Arkansas in 2018, which required for fair and reasonable reimbursement. Right?
Yeah.
So it's putting some definition around, or allowing the insurance department at least to put some definition around fair and reasonable, and forcing the PBMs to justify what they're paying is in fact fair and reasonable. And
you got to box them in, because if you give them any leeway, they're going to find ways around it.
Yeah, and maybe it's boxing them in, but maybe it's just asking them to follow the law.
Right.
That'd be really nice. They're not going to. They're going to ignore you and make you take them to court to follow anything.
The number of times that I've been in conversations where we actually are saying, have the PBMs follow the law. So in my home state, Arizona, just about everybody knows that. Every time this comes up, I'm always asking, get language in there that says they have to follow our laws. And initially it was my lobbyist I had to convince, and then it was other state legislators, but they began to understand why when they see things like what's happening in your state and other states, where you'll have an out-of-state PBM say, well, I'm not a domestic entity. Your laws are not my laws.
Yep.
I don't have to follow them.
And they'll pull all sorts of. That's one example of a stunt they'll pull. But they'll also pull a stunt and say, hey, if the employee doesn't live in if our business is outside of Arkansas, but the employee lives in Arkansas, then that employee doesn't have to be subject to the laws. And so we've had to go back over the years and put what's called extraterritorial jurisdiction language in the law to make sure that they can reach to those companies that are out of state to apply to Arkansas residents. So John and his team has done a great job over the last number of years.
Yeah, and thank John. So I don't know where John is right now, but
John is back in Arkansas fighting the fight. Actually.
All right,
so,
John.
which is good that he's there doing that.
And it's just a constant battle, and every time there's a win, there's a new battle to be had, and you got to defend every single inch you take, and that's just what we have to really focus on. Is it's going to constantly be a fight, and we've got to be mentally prepared for that.
Yeah, amen to that. And I don't know if y'all were in the second General Assembly or General Session this morning.
Yeah, we were there this morning.
The father who came out who lost his son.
Yeah,
Cole,
Bill. He's a good friend of ours.
What a moving story to bring out and share, and talk about fighting. We're definitely fighting for our profession, right? But we're really fighting for the Bills of the world and his son Cole, and to prevent those bad things from happening from a middleman system that is focusing on extracting dollars and providing no value and putting patients' lives at risk in the middle. And that's the stuff that fires us up to keep fighting.
Yeah, and thank you so much for everything that you're doing.
Oh,
thanks. So I know you were just walking by to say hi. I'm like, you here, but that's what that for everyone who's watching. When I do that, that's generally because somebody's walking by. I'm like, everyone needs to be in this chair. Thank you.
Oh,
thank you.
It's my pleasure. Thanks for letting me sit down for a minute. It's great to see you.
I do. Anytime. It's good to see you. It's good to meet you. Go have fun.
Yeah, I'm going to have fun. I'm going to find my wife, though.
And don't forget to take an orange bag with a pin. It's part of our social experiment.
I'm going to take the pin.
Okay.
The bags end up in my hotel room and they stay. So
that's okay. That's okay.
Is that okay?
That's okay. I've got you.
Oh, there's the pin.
Yeah.
I appreciate that, Kendra.
Yeah, thank you. All right, Scott. You have a great day.
It's good to see you, Scott.
In person, too.
Yeah, exactly.
Thank you, Scott. All right.
Hope you had a good birthday.
I did.
Good.
Thank you. Appreciate it. Thanks for remembering.
Yeah.
That was really
Facebook
kind.
helps everybody.
It does. Thank goodness for Facebook. So, do you think we should? Jack is standing.
Yeah, there's Jack.
Jack is standing directly in front of
You want to come
us.
say hello?
No,
You got a
no,
meeting.
no. You got
You got a
5
meeting
minutes.
with
Come over
Jeremy.
here. Come on. No.
No, I'm not on tomorrow. Yeah. We weren't even going to
Jack.
go on today. We were just
Jack.
like, let's just go on.
Jack, we're live right now.
What's that? Oh, yeah, I had to come and get set up. Yeah.
Jack, come over here for 1 minute.
Yeah. I appreciate it. No, I had to come get it set up because, yeah.
Maybe
I
it's
cater
better.
it to
Maybe it's
some
better we
audiences.
didn't have Jack on when he just said that. But it's Jack.
It's true. I've been catering it a little better for certain events.
Jack, who's the communications director of NCPA, standing at our table telling Jeremy to lay out the F-bombs. If you know anything about the PUTT's executive board and the number of times we've had that conversation, you too would be laughing about that. It's sort of like we've had that conversation maybe as many times as Jeremy has dropped that.
Yes, we have that conversation.
Although I say that as if I haven't dropped that bomb on the air or anyone else hasn't either. So no, it's all good. So while we're waiting for Mark Bozen to come back, did you talk at all about?
Oh yeah, Mark Bozen and Snow Law Firm. Him and Allison have been giving away these little owls. Ellison at the house, I've got you one of these owls, little tiny.
Yeah.
So Emily, this is what the owl looks like. It's adorable.
It is very adorable.
Yes.
Very, very, very cute. So there is a booth here. I did not even start talking about this at this point. I don't remember. There's a booth here that has baby animals.
Yes. Oh yeah. There's a petting zoo here.
There is.
Is it an evil petting zoo?
There's an armadillo which fits actually in your hand.
Yeah.
And it was asleep, all wrapped up. So I've never actually seen an armadillo. Have you?
In person, I don't think I have.
So it actually does have a shell and it curls up like a little ball.
Oh.
It actually does. It's very cute. And then there was a baby kangaroo. So I was holding it. It's 8 months old. It's like the size of a newborn, except it's a kangaroo.
Yeah.
And I was talking to the girl about it. I'm like, well, how big is this little guy going to get? Because I'm thinking it's like a miniature kangaroo. It's probably 3 years old. She's like, he's going to be 6 feet tall. And at that point, I was like, that's so amazing. So I'm just going to cuddle him more because he's a baby. And then they have a pig, but the pig is.
I'm going to have to check out these animals.
Oh, please. Yeah. Get a. They got
a kangaroo. I want to see the kangaroo.
And the kangaroo's name is William. Baby kangaroos are called a.
Roo?
Joey.
Oh, a Joey.
Yeah.
That sounds dirty somehow.
Well, Roo is named Roo, but he's actually a Joey.
Joey, it just sounds dirty. Like, oh, check out my little Joey. It just sounds weird. Like, it's like, I feel like Roo, like Kanga and Roo. I feel like Roo is a good.
Well, Kanga's the mom.
Right? I'm not a scientist. Well, I am, but
I'm talking about this like I have any memory of these stories. But anyway, all right. So that was Jack. He came over to tell us that he had a meeting in 20. He came over to spend 5 minutes talking to us about how he couldn't spend 5 minutes talking to us. I know. So I apologize that nobody could hear what he was saying. But he was saying what he actually said was that he appreciated
Angry Dad, HR 9096 or die.
He complimented Jeremy for, how did he say, making it easy to understand for dummies.
Making it easy to understand what's going on with PBMs for dummies. He said I did a really good job doing it. He said he was going to give me a shout out during the meeting I attended yesterday, but I had to leave early to come sit up for this podcast. But yeah, it's I like Jack. Yeah, Jack's good people. Dawn Hampton, my involvement will be more at the beginning of the year. Let me know what you want me to do, and I'll be happy to help. Yes, Dawn.
Thanks, Dawn.
Yes.
That's great.
We love seeing that.
Yes, we do. And I am not wearing my glasses, so I cannot see any of the other comments. But
yeah.
Oh. Here we are. All right, everybody. So you may remember that we had
the Zig is
webinar called Confessions of a PBM Auditor. The PBM auditor is here. Mark Ziegler, how are you? Reformed. I'm sorry.
Reformed. It's okay, people. He's on our side now.
Yeah. I was thinking about on that topic just real quick before you ask your question. So, so Taylor Swift has the Swifties and Beyonce has the Beehive. What we should have something. Like Shannon calls us the PUTT bowls. I don't know if that
The what?
PUTT bulls, like the dog pit bull. The pit
Oh yeah, the PUTT bulls.
As opposed to Pitbull, the artist that I refer to as the miracle whip of music. Like it's good once in a while. You don't want to make a whole meal out of it.
See, I feel like that explanation is too much. He's the miracle whip of music because he's garbage. Just like Miracle Whip.
He's not the real
Dukes forever. Dukes forever.
There you go. Okay. I'm still bitter about the all Pitbull jazzercise class I was in because Pitbull came to Phoenix a couple weeks ago. Remember? The next day in my class it was all Pitbull, and I was very like, we're not actually going to do this all Pitbull for the next hour, but as it turns out we were. So yeah. But enough about that because that's not fun to talk about.
Okay, Pitbull has actually commented on our live feed. He is angry. Pitbull, I know you are a dear fan of me, but I don't have to appreciate your music.
Pitbull, maybe
continue.
Yeah. Okay. All right. So
don't be so tasteless.
All right. So you're here. Y'all have a tool that you're promoting. How have you been? What have you been doing? How have the audits been looking?
PBMs are ever changing. Coming from the PBMs, there's things I see, and I'm like, wow, that's where they're at now.
Yeah,
that's what they're doing, and it's getting crazier and crazier. Yeah, we're here at NCPA to promote a more prospective, proactive audit solution.
Yeah,
and if I could hammer anything over anybody's head, it's that when you get that audit letter, get help if you need it. Like when you get the audit letter, because that first set of documents that you're going to provide to you, that's your best chance.
Yeah,
of surviving. Feel free to give us a call if you got 2 days for an initial appeal and you haven't got any documents together. We can help. We want to focus more on what you can do up front. And part of our solution is performing a mock PBM audit. We'll look at all the documents. We're going to request a dispensing report. We're going to analyze the top claims that would be audited by the PBMs based on our experience, my experience at the PBMs. And we're going to put you through the gamut. The benefit of that is you're not going to owe us $1 million at the end if that's what we find. But we're going to look for discrepancies, and what we offer an invoice review like the PBMs will do. And we want to find those discrepancies now when your contract's not on the line, when $1 million is not on the line, when you're not going to owe all that money, and help you. We can help you tweak your policies and procedures, your operations, so you know where your shortcomings are with your documents up front, so we can fix that. So when you get that inevitable PBM audit, you're ready to go. Yeah. Because if you have it fixed before, you'll be able to get that documentation ready over to the auditor. You're going to help mitigate a lot of those big findings.
Dude, what are your thoughts on the stupid what's that? What do they call the PVRs that they're sending out? Because those are like full audits and they are in violation of certain state laws, like in Virginia.
Prescription validation reviews.
Yes. Yeah. That is a full violation of Virginia law.
Daily review. They called all kinds of things.
Yeah.
And I mean, where I come from, they weren't considered audits. It was just a telephone call to make sure it was done correctly. And if it wasn't, you could fix it ahead of time. Yeah. So that's a shaky area sometimes.
Yeah. It's evolved now. They're not just verifying and doing it. They are full on sending.
They're going for the documents.
They're going for the documents. They're clawing it back.
And they want it back. Yeah.
How you doing, Mark?
Yeah,
how was your talk?
The principals are here.
Yeah.
So, are you okay if we let Mark and Allison take our seats for a minute, and then we'll I will come back. Yeah. Okay. All right. So you guys, everybody, you're in for a real treat because Mark and Allison are fabulous and fun people.
You're getting both bosun and snow.
Getting bosun and snow, and the world's cutest little
and the cutest owl in the world.
Okay, all right. So I'm gonna stand up and give the space.
Come on in, y'all. Let's set this up between you.
Bosun and Snow, 2 for the price of 1.
Bosun and Snow is here. Yeah. 2 for 1.
The house.
Yes. Here, y'all.
Jeremy, so good to see you again.
It's good seeing you, brother. Yeah, it'll pick you up just fine. Okay. Like we've got it tuned out. Like you're gonna be all right.
All right.
You all. It's good to see you all here. Like. Are you all struggling as heavily as I am today after our cocktail party last night?
I was very irresponsible.
Me too. I'm super responsible. It's what I'm known for. Responsible Jeremy.
It was fun last night. It was fun. It was a good turnout. You guys know how to throw a party.
Yes,
and
it was fun.
We picked the band. So
They did a good job.
We'll take credit for the band, and I thought they were excellent.
Yeah.
Good music choice. So.
Yeah. I almost went up there and grabbed a guitar and shredded, but I'm way out of practice, so I did not torture anyone. It would have been fun.
It would have been.
You would have got a very bad version of Master of Puppets. Very bad. I would have thought it was impressive.
They were 3 guys, and they did some Britney Spears. I'm like, that takes guts.
Yeah.
Nice job doing the.
They were very creative.
Yeah, they did a nice job.
They did such a good job. And the Beetlejuice bar was fun. And then it's also good to just like talk to everybody, like seeing everyone. It's good seeing you all. It's good seeing like all of our people out just having fun together, because I mean, this is a hard industry right now. So it's good to like at least find some joy with each other and do this together, you know?
Yeah, oh, absolutely.
But yeah, that's what you all are for. You help save all our asses.
We're trying. We're trying. The GLP-1s are probably the only thing keeping most of the people alive right now. And when the shenanigans happened on October 2nd, I'm like, I said to Allison, I'm flying to Washington. I'm going to fix it. And, you know, we've been doing the advocacy piece. That's what I just talked about with this group. We did the advocacy piece. Baker Hostetler's doing the federal cases. We're coordinating that. So far, so good. We're keeping the FDA away.
Yeah.
But it's a constant fight.
It is.
If it's not PBMs, it's the manufacturers. If it's not the manufacturers, it's, you know, something else. It's the elections, and whether or not there are going to be new regulations or we're going to get rid of regulations. I mean, that's what this election is about right now. Do the regulations stay? Do they get more? Do they go away? Pharmacy doesn't need any more regulations.
No, God, no. We have too many. They need to start regulating the PBMs, like the people that are like sucking all that money from the system. We don't have anything else to give. Like, there's nothing left. Like, leave us alone. Well, actually, no, don't leave us alone. Pay us. For the love of God, I'd like to just like make money again at some point. That would be really cool. But instead, like, this is what I always tell them. You all could have just paid us fairly, and, you know, you wouldn't be under like all these investigations. And also, you wouldn't have to deal with the monsters you created, one of which is me. So they did this. I'm not responsible for what I did.
On yourself.
Yes. What's that? Oh no, you're good. I've not even switched over to it and stuff. I'm just having fun here.
I like this setup.
Yeah. I spent a lot of money doing it. Like
professional.
Yeah, I've done a lot of
upgrading. Legit podcast.
Right now, it's midday on Monday, and we have 79 live viewers on just
thanks for watching
Twitter and stuff. Yeah, so
thanks for
we're
watching
doing pretty good.
We have a good time, and we are working hard for you. Thanks for doing what you're doing back there at home in Radioland, but we are working hard. I had a conversation, Alice and I, with a colleague, another pharmacist attorney. We are at a tipping point.
Yeah.
Community pharmacy is either going to survive or it's not. And it has to get better. I was sitting at a table last night with some of the old guard, Steve Molinek, Don Latender, and I'm like, those guys worked so hard.
Yeah.
And then the PBMs are going to ruin it.
Yeah, they are.
I am not going to let my dad, who's a pharmacist, Don Latender, Tom Temple's legacy, I'm not going to let those guys down. We're going to fight for this thing.
Exactly. Like, if they're going to try to take us out, I'm going to take a lot of chunks out of them while I do it. Like,
we're going down.
Yeah, they're going to go down. Like, right now, it is outlasting and just trying to survive through, because they can't squeeze anymore. They're going to try to shut down as many of us as they can in the next 2 years. And we've got to get through that. We've got to get an HR 9096 passed so we can establish our actual reimbursement at a level where we can justify existing. Once we do that, we can look at other revenue streams. We can do more. We can, be a part of our community again. And right now, we're just asking for enough to survive. Like, that's where we are. It's sad. Sad state of the industry, but that's what we got to do. And you all, as with your fight and what you're doing, because it's not, you all, like, of course you've got like your auditing services, and you've got your legal arm and everything. But most of the stuff, you all do so much. Like, even going around with the GLP-1s and stuff, like, you all are awesome.
Well, I want to brag about my partner a little bit, because he has spent a career, and I think this is something that he tries to teach younger pharmacists and even the attorneys, is that it's just it really is showing up. And I have seen Mark just continue to show up year after year after year. He shows up and he's present. And, a lot of times I think people, some people are frustrated. I see this in younger professionals. They're frustrated that they don't have, the traction or the relationship as quickly. Well, I met with so-and-so and Mark is a testament to just showing up and really, I'm quite proud of him and grateful, but there's not a pharmacy bill in Arizona that doesn't come through our firm and Mark is not asked to opine on. And so you gotta show up every day and eventually that will pay off.
Yeah. You chip away, you develop those relationships.
So kudos to you, partner.
Thank you.
Yeah.
That's very sweet. But I think Allison said it right, it's an investment and it takes a long time. I've gone to, when we moved back to Arizona in 2003, I went to the Capitol every day and it took forever for people to remember me. You will continually reintroduce yourself for 4 or 5 years. And all of a sudden they'll start remembering who you are. And then they'll start saying, hey, I've got to proactively reach out to these people. Do not give up. It's developing the relationships. And then all of a sudden overnight, you're like, oh, okay, now people know who I am.
Yeah.
But so many young people are like, how do I get there? And
it's grind.
It's a grind. It is. And it's boring. Some of it's just boring and it's demoralizing.
Yeah. It really is. You take those losses, you got to just take them on the chin and just keep doing it.
Just got to keep going.
Then you come to these conferences and everyone's like, hey, out of nowhere, because eventually you get them where you've made those relationships. And it's the same with lawmakers and their aides. Like, you go in and you got to remember, you're not just like making friends with lawmakers, you're making friends with their staff. And that's just as important, because even if that lawmaker isn't going to support your bill, you never know where any of those staffers are going to end up.
They move around.
They move around.
It is a small world. Our clients, someone goes to a competitor, so it's a small world.
It is.
Yep. You got to remember that.
You have to go in there, you talk to them, and you got to remember, like, even committee staffers, like, if they end up being a committee staffer, they are very valuable to know. Always make those impressions, always go in there and talk. It's that important. Like, form those relationships. Like, you all, we love you all. I would never have, before, been involved with this, and I owe so much credit, to PUTT for giving me that platform, because, any other organization, national organization, wouldn't have been like, all right, let's throw on the drunk pharmacist who curses all the time and give me that platform. But they have faith in me because they knew me. And because of that, I get to know you all and I get to do all this cool stuff.
It truly is amazing. Well, let's talk about showing up. How long has PUTT been PUTT?
Yeah.
I mean, now it's a presence.
Yeah.
But the first few years, we had to explain what the letters meant and who the people were. And we even had NCPA talking, well, that's the drunk uncle. And no. And but you had Doug on in St. Louis, and I'm like, wow. So
he
Doug's
came on for Optum too. Yeah.
And I still give him a hard time about, we're all in this together and we're all on the same team. And you want all the players.
You do. You want everyone. We got to get everyone behind, and we got to stay pharmacy, because right now we need all leadership and everyone working together and really pushing it, because we've got our window. We forced that window open. Now we've got to get through there.
We absolutely do.
Everyone brings a little beer to the party.
Bring some beer to the party. Exactly.
Well, and there are thousands of policymakers, and they all have different personalities.
Yes.
They're going to gravitate to different people.
Yep.
Arizona. So I'll tell you what I did, Monique, this morning. Do you know who asked me for that picture? I took the picture yesterday, and I was going to send it yesterday.
Let's show it, Monique.
The Arizona delegation.
There you go.
Yes.
So this is Arizona, and this is Beautiful South.
So
we need to add Arizona to the board.
So I got a letter. I got an email. I actually got a text this morning from Representative Big Staff. He asked me for money, and I said I sent some money, but hey, I got a picture. I need you to send this to all of the delegations. So that went to the Arizona delegation this morning.
Yeah.
And we need to turn. The only request is, instead of purple, if we can get Arizona, can you make it red?
We'll make it red.
Thank you. Andy doesn't want a purple. He wants a red.
Okay, I will gladly do that.
Representative Biggs, it will be red.
It will be red. We need you on.
There you go.
You can count on that.
Get a red Sharpie.
Yep. Arizona's. They're hoping for a red state this year. Arizona didn't used to be a purple state. No disrespect to the purple states, but
Apparently, neither did Texas.
well, Ted Cruz has a tough race. Texas may very well go purple. We'll see.
It's pretty tough.
It is tight.
We'll see how that goes. But you all, we're going to end the cast here soon. Thank you all for coming on. I love having you all on. You're wonderful.
Thank you for having us.
Thank you for all
roll
you do.
on. Oh,
So
just saying, Jeremy, I'm just having fun, and
so
I get
Jeremy,
to do all this. Like,
Maurice, Shane, you guys
Yeah.
have created a culture that is impressive.
Yeah.
And the comedy that Maurice and Shane do, and
Yeah.
that you do, and it's given some personality
Comedy?
to a profession that doesn't have a personality that often. Monique, yeah.
Monique is great.
Monique's
Monique is a
The
gift.
goat.
yes.
I've seen a lot of nonprofit organizations come and go and be here.
Yeah.
PUTT is special.
Yes. And a lot of that has to do with Monique and everything that she does.
100%.
And what's great about Monique is that she's like, I just learned about this industry and this thing, and
Yeah.
then she became so passionate about it. And I'm like, and you know, she's not a pharmacist, and that's
Yeah.
incredible.
It is.
That, you know, it's just something that she learned about and that she became so passionate about.
Yeah. And she's now like one of the most influential and wonderful people in pharmacy.
Yes.
Like, everyone knows and loves Monique.
Yes.
Anyone who doesn't love Monique is a bad person, and I will come for you.
Yes.
Can I say that, legal team?
Absolutely.
Sure. It's
Yes,
not,
they
it's
said
not,
I could.
It's not directed against a specific person.
It is not.
So,
It's a good thing I didn't name you.
right.
Thank
Yeah.
you.
Thank
You all,
guys.
thanks for coming on.
Thank you.
You all
Thanks for
start
having
coming
us.
on like every so often
All
so
right.
that we just get on, pop in, have a drink with us on the show.
All right.
Yes.
Thanks, everyone.
All right. Hey, everybody. One more guest. Okay. All right. We got one more guest coming up. Thank you to our over 100 live viewers right now in the middle of a Monday. I didn't expect anyone to be on today, but it's good to have you. All right. Monique and John are coming back. So we've got a bunch of people watching right now on a rando Monday
Oh,
in
that's
the middle
so
of the day.
great.
I love you all. I'm
Yay.
glad you're here. Why are you watching me? I don't know. John, welcome back.
Hey,
Scoot on in a little bit. Actually, I'll do it like
not
this.
on camera. I have to be on camera.
Yeah,
Yes, you
Not
have to be
worth
on
it.
camera.
Yeah, you do. All right. Here, and I'll move in a little
Yeah.
bit too, so we're all on camera. So we did this. This was a pop-up. That was my word for it, because pop-up bar, pop-up restaurant. But it actually went like this. Yesterday was a lot of fun, and we saw a lot of people that we didn't get a chance to talk to. Like, I'm looking at Miguel right now,
Yeah.
and and I was like, hey, what if we just do another one tomorrow? Like,
Yeah.
because we hadn't planned it.
Yeah, well, it's already set up still. Why not? And
Let's
I was
do
like,
it,
okay,
right? You know,
I'll do
so
that.
we'll do a pop-up, right?
Yeah.
So here we are. We're doing the pop-up, and we have had, it's been a good conference. Have you ever been to the NCPA conference before, or exhibited here?
Oh, yeah.
Okay.
This is like my fourth one, maybe.
Fourth one.
Yeah.
Okay.
And I know AHF's done it before, but
Okay.
but yeah. So
Well, we've already established I just had a birthday where I'm getting older and older, so maybe I need to take some. What is it? What's the one that's made of jellyfish? The
What?
Prevagen.
that's it.
Yeah.
There's a whole booth of it over there.
Send me some Prevagen.
Yeah, last year I did a video for you telling people to give
Oh my
money.
God, you're right.
Oh my God.
Wow.
Yeah.
Why did
Yeah,
I think you were
Monique.
just visiting? I didn't think you were exhibiting. I don't know what. Don't pay attention to me. Don't pay attention. Let's just do a do-over.
How embarrassing, Monique.
I know, really.
And
Jeez.
here are people, both of us are like, she's amazing, and everyone knows who really likes her. Then I show up and I'm like, oh, have you ever been here before, John? So,
Yeah, I saw you last year.
Yeah.
You drunk?
yeah, I wasn't, as it turns out. I wish that would have been a good excuse.
Just make it. You were, yeah.
All right.
You were high.
Yeah, there you go.
Okay. Okay, so I wasn't, but yeah. All right. Anyway, so here we are. So what did we learn? What did we learn?
What have we learned? I
PBMs
cannot
suck.
drink 3 days
PBMs
straight
are bad.
anymore without suffering for it.
Jeremy is also
PBMs
getting
suck.
Okay.
I'm not getting old. I'm just realizing that I cannot go like I'm in my 20s anymore.
It happens.
Yeah, I mean, eventually it just, just works out that way. But
Yeah,
It's okay though.
it's okay. I'm still Jeremy.
You are still Jeremy.
Exactly.
Yes, you are.
Unfortunately.
There's a great cup with cats on our table. I don't know how that got here, but I bet it's John's.
What? Those are cats.
Yeah.
The cat cup?
I mean, my husband and I have 6 senior cats at home. We adopt
6.
We adopt senior and special needs kitties, and I have one in my office as well. So we have 7 cats that we take care of.
7 cats.
That's
7 old
beautiful.
cats.
7 old cats.
That is great. That's
John,
a
that
one.
that sounds like a what would a sitcom, like
7
the-
senior cats.
7 senior cats.
Yeah, it's fun, but they're chill. They hang out. They're old, but
Yeah.
they need a lot of extra attention and a little care. And
Yeah.
the one cat that's like bonded to me, he wanders around the house when I'm not there, waiting for me to come home.
What's
Yeah.
his name?
Roosevelt.
Oh, that's a good cat name.
We don't always get to name them because they're older. A lot of them, they come to us from some other situation, but
Yeah.
Roosevelt came to us with his name.
Oh, that's nice.
Yeah, so
That's nice.
I have a
That's
cat.
good name.
His name is Cat.
cat.
Yeah, it's very easy to remember. And people are like, "Oh, did your little girl name the cat?" No. This cat was around before her.
That was the question I had too.
Yeah.
Like, I didn't know that Ellison could name cats, but
No, I originally named him Danny Rojas from Ted Lasso.
Right.
Because he was the opposite of Danny Rojas. He was mean as shit.
Oh,
So I named him Danny Rojas. And Emily just
Danny Rojas.
wasn't having it, and she just started calling him Cat, and it just kind of stuck. And so, yeah, at least it's going to be easy for Ellison to say his name.
this is true.
Yeah.
Yes, well, that's that matters.
Yes. Hi, Cat.
So how has this been for you here? Like, how has it worked out?
For us, it's been really good. It's been eye-opening in a lot of positive ways. We're always happy to see our good friends.
Hello.
Thank
Hello.
you. So glad that you are
Hey.
here, like our good friend Nasir here.
Well,
That the people can't see you. You want to
Here,
pop
let
around
me
here?
change my camera.
Oh, there he is.
Oh, there
Yeah,
you
there you are. Say hello to everybody.
That's who we're talking to. Yes, thank you so much. Love that
Good seeing you,
9096 pin.
Woo!
That's good. We've learned that
9096 is quite popular here, you all.
yes.
That's good. Except
So
with certain people.
a couple people, maybe not so much. So so I think we've now shared the story several times, but we decided we'd do the social experiment. It is a social experiment where we would try to flood this building that we were in with orange bags that say, "I support HR 9096." So we started with 500. We gave away, I'm pretty sure, at least 300.
Yeah.
Gave away more pins. Another thing I learned is that if people like your pin and they ask you for it, I might misunderstand and think they're demanding it. So I just take it off and give it to people, and then I have to constantly keep replenishing my pin.
Yeah.
That's happened a few times. But I think there is an appetite for what this bill represents, and we are excited about the possibilities for that. Now, I think, you all run nonprofit 340B pharmacies. I actually don't know what effect it would have, but I would like to think it would be good for your pharmacies because so it's for Medicare, it's for Medicaid, it's for the federal employees, it's for TRICARE. I'd like to think that if any of those, came through, if you took any of those insurances, it would be helpful to your pharmacies as well.
Yeah, we do take all those things, and
Yeah.
So I was looking at it. It seemed like it wasn't a direct thing, but we have somebody at our place who's like, oh well, that line, and about that line. So we're very picky about the stuff that we get behind. So
Okay,
Yeah.
that's good to know.
we're pushing on the 340B side, the 340B Sustain Act, which was introduced by Doris Matsui and Jerry Welch in Vermont.
Okay.
Okay.
Welch or Welch. Anyway, the other senator from Vermont.
Okay.
Yeah.
All right.
The one who doesn't talk like this. Yeah. So
The one that nobody knows because of the other guy
Right.
from Vermont. Yeah.
and that's a bill that'll protect contract pharmacies and allow organizations to use any contract pharmacy they choose without any interference from pharmaceutical companies.
Oh, great.
So it codifies that. We're building co-sponsors just like this. You try to get co-sponsors and try to get it to move along, and then you have to hope that the Speaker of the House is not bought and paid for by whatever interest this is working against, and then we'll actually introduce it or let it go through. So that's the
Yes.
struggle with any. It's, you gotta
it
get,
is. I mean,
you got to
there's
figure out how
such
to
a
get Chuck
dance.
Schumer and Mike Johnson at the moment to agree to put it on the floor.
Yes.
Yeah, not easy to do.
Neither of them are easy to do.
Even in the best of circumstances, it's not easy to do. And so we learned, one of the things we learned this week is that there is a massive misconception. It started with me thinking, oh, it's easy to get co-sponsors. And then we learned, because for 9096, with the number of co-sponsors that we had, it took at least 200 hours of conversations by many, many, many pharmacists, and then acts of petitions. And then we way more conversations than that. So we've actually had people turn us down.
Sure.
For that. What your bill that we were just talking about? Tell me the number again. It's or do you have
this is something I should know right off. What's this? It's a 340B Sustain Act.
340B Sustain Act. That's good enough. We work
But
with
I
that.
definitely that's something like my boss is going to see this and go, "You didn't know that. You should know that."
Yeah. But I mean, getting co-sponsors
I feel for
is
you.
tough.
My boss is kind of a jerk.
Like we're up to 37, and it's taken a ton of time and effort, and it's something that's not easy to do. And I think right now we have, if you count all the legislation, like pharmacy legislation right now, 9096 has tripled the number of co-sponsors as all other pharmacy legislation out there right now. So it shows you that not only there's an appetite, it also shows you what happens whenever you get a bunch of pharmacists out there grinding and behind something. Momentum's huge in this.
And you see, well, I talk about it, it's a good way I looked it up, because it's called the Patients Act. The
Patients Act.
Patients Act.
Okay.
It's not our favorite thing. So we don't like that
Gotcha.
one.
Don't like that one.
It's a good
Disregard everything John said a little while ago.
Scratch all this about Sustain Act, but it's
That's
so it's
John's
HR.
version of when I was like, so have you been to the conference
Exactly.
before? So we just pretend we didn't
So
see
it's
that.
HR 7635, and it's the 340B Patients Act that we're trying to get support for. That's the bill that protects contract pharmacists.
That's the one.
Good.
So
Okay, the Patients Act. That's good. That's good.
yeah. So that's look at legislation's a tough animal to crack. Sometimes it's easier in the states. As we've seen, a lot of states have had good PBM reform issues pop around. Our attorney general here in Ohio has been very anti-PBM and has gotten some money out of them.
Yeah. Ohio's been doing a great job.
So, we're not doing a great job with a lot of things, but that our attorney general was, we're good about that. So we're happy to see Dave Yost go after
Yost
PBMs.
punch them right in the
And we
mouth.
are too. That's what we want to see all of our attorney generals doing, and he's been great about that.
He has. Right.
We had Scott Pace from Arkansas was on earlier. He was the CEO of the Arkansas Pharmacists Association. They passed Act 900. That became the lawsuit we all know is Rutledge versus PCMA, which PCMA lost. That is because Scott worked really hard. Leslie Rutledge was then the attorney general. That's what we want to see. Like every state can be so lucky to have that.
Absolutely. And then speaking of PCMA, dragging them on Twitter is always
it's so fun.
I watch you guys do it, and then I jump in there once in a while, and it's just like the stuff they say is so outlandish. It is.
I mean, propaganda. That's really the only word for it.
Right.
You can say, oh, lies. No, it's full on propaganda because it is targeted toward misleading people.
Yep.
Right.
On a national scale. It's really bad.
The sad thing is it does mislead people.
It does mislead
and it costs real money. It costs real time, health, lives sometimes because of that propaganda. And then when held to account, always they throw the employer under the bus. They will throw the patient under the bus. They will throw anyone under the bus but themselves, the ones who designed the plan, the ones that set the co-payment at the pharmacy. And it's crazy because we're all so used to it, we don't even think about it anymore. Like we think of our co-payment as the price for the medication. I mean, not always, but sometimes when you've got an expensive medication. But with the generics that are typically cheaper, it's easy to forget, no, this is your cost share. And you don't even know if your cost share, if you yourself are paying way more than you could be. And that was, so like what I shared in an interview about Mark Cuban about his drug company was last year, discovering that off of my insurance with my cost share alone, I saved $700 just buying it at a cash price from another pharmacy. Now I could pick it up at my pharmacy. Right. My pharmacy got some benefit out of that. But it's crazy. It's like you have to stop and think for a second. The insurance that I pay $700 a month for is charging me way more. A month's payment over the course of a year is what I would have saved. And every time I think about that, it blows my mind.
Yeah, it's the money that's floating around in this whole industry, and it's designed to be confusing. So for the consumer, healthcare is designed to be confusing. And medications, people think GoodRx is a good thing, and it's not. That's a whole other fiasco. But they're led to believe because the advertising that's put into it, and you've got Martin Short looking funny, and that's good.
There you go.
And the people buy it, they fall for it. Pharma has boatloads of cash to say whatever they want, and they do. And PBMs have boatloads of cash to say whatever they want, and they do.
That's what finance calls mego, and it's my eyes glaze over. It is intentional because whenever you try to like hammer it down or talk to regulators or lawmakers, it's just like you start going AWP MAC and all these other terms, and they're just like, what? Like it's hard. They do it intentionally, and I mean it works.
Yeah, sure. How many people have they sent to their happy place when the moment you have to start defending yourself, and they're over like planning their vacation because they don't understand it anymore?
Yeah, exactly. It's hard.
Yeah.
And they follow the rule. The more you say it, the more it becomes the truth.
Yes.
Just keep repeating it. Just keep repeating it, whether it's true or not. People will believe it, and they'll repeat it.
And often people, even if they don't truly like believe it or know, sometimes they just need an excuse to look the other way or to let this continue happening, because it's like, yeah, but they're saying this, so I think it's okay to take campaign contributions from United Health. So sometimes they just need their excuse.
Mm-hmm. Yep.
And that's what PCMA provides, an excuse.
Yep. It's the big excuse organization.
Remember back, well, you don't because you were just a baby when PUTT was founded, but we actually thought
a baby. It's only been around 12 years.
It's been, since 2011. So
2011.
So it's in 2024, 13 years as of September.
I was in pharmacy school.
Were you?
Yes.
Oh, so you were a baby.
Yeah.
Okay. So we all thought, we'll get attention on this problem. Everyone's going to see how bad this is, and it'll all get fixed up. And it looks like the way things are going, it's going to be a little while till we get to that future. But it's okay because we've got good friends like you. We've got us. And I think we're coming into that part now. We're going to start winding down our podcast, but not until John says what he was going to say.
I was just going to say, I think it's a good time now to bring back the conference. This is how we got introduced to PUTT.
The
PUTT
Summit.
Conference, and the summit was great. It was helpful, and it gave real information, and it wasn't at the whims of a lot of the different where maybe some of the funding came from or whatever. It was real information. It was really helpful. And I think now that PUTT has grown, has much more of a following, a podcast, that summit can come back and we can provide people lots of valuable information on how to fight these bad guys.
That'd be fun. And I can give speeches. I love to give speeches.
And then we can have receptions.
Yes.
Yeah.
The in-person summit is fun. In fact, I would ask anyone who's listening if you'd be interested in an in-person summit. Let us know if you have suggestions for where.
Not Florida.
Not Florida. Sorry, Florida. We love Florida, but it's hard because that's how your income taxes are paid. And anyway, we don't want to talk about that. I think that's a wonderful suggestion.
Yeah,
Thank you. And there's one last thing I do want to ask though, before we close it down, and that is, so World AIDS Day is December 1st.
Correct.
I was in high school when the pandemic broke out, or epidemic. I confess I don't know the difference, and it was such a scary time. Everything that you all have done really laid the groundwork for everything the rest of us have done in healthcare advocacy. So the first thing I just want to say is how very much from my heart we love and appreciate the work of the AIDS Healthcare Foundation, and how much we love and appreciate the families who advocated for their loved ones, who helped make it what it was. You have the Ryan White clinics. Is that right? Yeah, I remember Ryan White.
Oh, yeah.
And so thank you for that. And then I think we may try to do something. We might try to collaborate.
I think we could, because there's a lot of PBMs affect a lot of different people, and people living with HIV are definitely affected by PBMs in negative ways.
Yeah.
Whether it be, I just was talking to an independent pharmacist who was telling me how he can't take care of people who have HIV because the PBM has cut their reimbursement, and it's actually less than what it costs him. So he's got to lose $300 or $400 per patient He said, I just can't do that. Right. Unfortunately, there's an AHF that's not far from where he is. And so he says, I send people to you because then you don't have to worry about that. But he feels bad because some of these people are his regular patients that were taking care of their families, and he has to turn them away because he loses so much money.
Yeah, it's tough. Like, you don't want to do that to your patient, but you're forced to just to exist.
Yeah, and just
it's
like
hard.
The issue that Loretta has brought up a lot of times about mail order, right?
Yes.
People with HIV, mail order for some of us, for me, my husband knows, I'm out. Like, it doesn't matter. But if you're a young kid who's kind of couch surfing and you're living with some roommates, and this package shows up and somebody opens it and says, oh my God, Billy has AIDS, and let's kick him out, or this becomes a problem. So
the stigma's still there because people, they don't understand it. Even with all the work you all have done, there's still like that stigma out there, and it's hard to get through to people.
Stigma's tough.
Yeah.
And PBMs almost reinforce it with some of the things they do.
It's just a more sophisticated, algorithm-based form of discrimination.
Right.
And it's happening to patients with chronic illnesses everywhere. But I did want to just take a moment because I really think we owe so much of what we are in this country now to the work that you all have done. And I just didn't want to.
And it's a collective thing. There's a lot of activists that had come together to make this happen, to make noise. A lot of them weren't with us anymore, but who really, and allowed an organization like AHF or an organization like here in Ohio, PUTT, and others to kind of come up and be able to take care of people with HIV.
Yes.
Great. Thank you. So we're excited. We'll do something for World AIDS Day together collaboratively.
Yeah.
And I just want to, I don't often get to be in a live cast like I have the last 2 days with you. And it's really been.
You're awesome during the live cast. Like, you need to do live casts with me on these events. We're going to, us and Lauren and everyone, we're going to start doing these live casts together and bringing everyone on, because it's a lot better when I don't have to do everything by myself, and I can do more color commentary because that's what I'm best at.
You are best at that. So, and again, I know I'm like, we're going to close down. Then I'm like, but one more thing. So if any of you out there who are, even if you're not a PUTT member, we have something called the PBM Reforum, which is a fun take on a accidental misspelling on a sign not long ago, but it is a WhatsApp chat group.
Dawn is saying we should have the summit in Worcester, Rhode Island, right before the protest.
Oh,
that's not a bad idea there, Dawn.
Or is it Woonsocket, Rhode Island?
Okay. Either way, I like that idea. So we have this WhatsApp chat group. Today we were doing a text play-by-play with color commentary on the general session. Anyone who has an interest in being a member of the PBM Reforum can contact us either at info@truthrx.org, or if you are a member, still contact us. You can get me, Monique, at truthrx.org. We'll add you to the group. If you want to know more about it, contact us. We'd love to have you be part of the greater conversation that pharmacy owners, pharmacists, and friends are having about PBM reform.
Yeah.
So
get involved. Get out there, get in the fight, have fun with us. Have fun with us.
Yes.
Because we can fight, and it's a serious fight. But we can also have fun together, because moments like these where everyone gets together, they're special. And sometimes this is the highlight that you have. We get John. We get to hang out. It's fun as hell.
Absolutely.
Yes.
Very good. All right. Well, I think that does it for this podcast.
I think we're good, y'all. We've got to start cleaning up. They were actually starting to break everything down. Their trash cans coming around.
Actually, it's the other way around.
Oh no, we still got 2 hours.
Okay.
For an hour and a half.
But yeah, you all, it has been a pleasure being with you. Check out, of course, DataScan. Forgot to mention DataScan at the beginning. They are awesome. If you're switching from Pioneer, you're going to save like $600 a month. So check them out. They do everything. It's awesome. But it has been a pleasure being with you all. Thank you for tuning into our impromptu podcast here on day 2. We'll have more coming your way, including Ted Teddington. All right. You all have fun. Shannon's going to take us off the end stream, and we are out, y'all.
All right.